There are approximately 66,000 people in this country that are currently providing care to family members or friends, close people in their lives. And there's very little overall, especially in medical centers, that is offering direct caregiver support to those people.
The caregiver support unit is basically something that's for the patient's family. The patient is in the hospital, getting all the attention from doctors, nurses, and they're being taken care of. But the families sometimes feel left out. There's nothing there for them. There's no one there to comfort them.
And so caregiver support is helping that caregiver deal with all the various emotional and physical stresses that are part of that role. What we wanted to create was truly an oasis within the hospital, a place where from the moment you walked in the door, there would be a feeling of serenity and calm, and it would look different from other parts of the hospital, and it would just be a very soothing, relaxing, welcoming environment. You walk in and you're met by a very, capable professional receptionist who's very well informed and took part in the training as well.
Welcome to the Caregiver Support Center. My name is Lena Dolmo. Here you'll find a room which is utilized by the doctors from ICU and palliative care to meet with family members, just to get them away from the bedside of the patient and just to have an area where they can find a little bit of peace and quiet. Even after they have a meeting, the family members will stay here and utilize the space just to get their thoughts together before they go back to the bedside of the patient. The conference table here is utilized by the volunteers who are here between the hours of 9 and 5, and they're here to meet with the caregivers. Over here we have computers, which is utilized also by the caregivers. Many of them use it to communicate with family members that are in long distance. This room over here, it's being utilized right now, but we have a recliner in there, we have books in there that people can read and just relax. We have sound machines here, which will give them a little bit of privacy if the doctors are meeting in one of the rooms or the families are just there having a conversation. We'll turn on the sound machines and gives them a little bit of privacy. We have a skylight there, which is just a beautiful thing to look at. And we have the waterfall, which soothes a lot of people, and they do feel very relaxed.
My name is Phyllis Cobb. My husband's in the middle of having a liver transplant as we speak, and to just have this gift to be able to relax during this very lengthy procedure in such a comfortable environment means so much.
I thought this was just going to be kind of a sterile waiting room, and was blown away when I walked through the door at the nice little waterfall thing they got going on over here, and the fact that we have our own private space to be able to just be with ourselves and, not have 1,000 things happening around us, which is often the case in a hospital.
The minute you walk in the door, it's like you're stepping out of this hospital environment into this peaceful, serene place that really just reduces your level of anxiety tremendously. I know that how important it is as a caregiver to be able to take care of myself. I can't be any good to my husband if I'm falling apart myself. This is really a blessing to be in this environment here today while my husband's in surgery.
So it's really like a respite. It's a respite within the hospital where they can go and speak with someone if they choose to, where they can read books if they choose to, where they can go on the computer and check in with their email or look up different resources. We're there to help them, and we're there to also give them their privacy if that's what they choose to have.